You just found out you're pregnant. Now you're wondering if you need to throw out all of your skincare.
It's the biggest question that we get asked when someone is pregnant, and I think everyone will be super surprised to know you can almost continue your entire routine.
Maybe you're really lucky and just have this like glow about you, and then other people are not so lucky and they see increased pigment, they see sunspots, they have melasma.
You mentioned this not too long ago. It's 2026 and there's no reason that you can't have a sunscreen that you absolutely love every single day. Let's say at the same time. Okay. One product that I think of when I think of barrier support. Ready?
What? Oh, I don't know what you're gonna pick. Okay, I have mine.
1, 2, 3.
DJ.
Oh, wow, different.
On balm.
Yeah. Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way. You just found out you're pregnant. Now you're wondering if you need to throw out all of your skincare. What can you keep? What can you
get rid of?
Today we're going to go through how to keep your skin looking great, dewy, healthy during pregnancy, what you can keep, what you should toss.
I think that before we even get into any of the products, it's the biggest question that we get asked when someone is pregnant, and I think everyone will be super surprised to know you can almost continue your entire routine.
Literally everything.
Don't change anything.
Like that could just wrap up the episode.
All right, we're done. But I had a friend though text me. He was like, I'm trying to get pregnant. I haven't been using any of my skincare.
Same with my patient.
I was like, ma'am, you can keep slapping everything on until the day that turns positive, and even then most of everything can just stay the same. Like,
yeah, my patient's like, I stopped my retinol just in case. I was like, but you're not pregnant yet.
Right. I think that goes with almost everything in aesthetics. Maybe people have differing opinions, but mine is of do it all up until, like nothing's off limits until it's positive.
Well, and think about people not realizing they're pregnant like those first few weeks, and they have wine, they have alcohol. I mean, that's a lot more damaging to your growing fetus.
Right. Or like the people out boozing and they don't even know, or the one night stands in college, and then 6 weeks later you're pregnant.
Exactly. So they were
got
boozing
pregnant
the whole
while
time. They were drinking.
Yeah. So like, I don't think you're stopping any of those things. Maybe you are, but this you do not.
Yes. Anywho, and of course, like your OB is definitely the professional in all of this, but we know a thing or two as well. So what happens to your skin when you're pregnant? Maybe you're really lucky and just have this like glow about you, and then other people are not so lucky and they see increased pigment, they see sunspots, they have melasma.
And it's all hormonal changes, obviously.
Dryness, acne is a big one, some swelling. So let's just talk about what to focus on to kind of target all of that. It comes as no surprise that you should continue your sunscreen.
Every day till the day you die.
And because you're more susceptible to pigment changes like melasma.
Right. I think melasma is going to be the one thing that you may have never had your entire life, and then you get pregnant and it can erupt. And it's a very classic, easy to spot.
Yeah.
There are unfortunate people who, like Megan, who has melasma, not pregnant. So I can only imagine what will happen one day.
I hope nothing. I mean, I hope that I become pregnant one day, but I hope the melasma doesn't happen.
Like goes away. Maybe it'll happen to you.
Yeah, but it's like when I turned 30 and started playing pickleball, all of a sudden I had melasma on my upper lip.
Yeah. A lot of things happened to you hormonally when you were 30, like face-wise.
I know.
Like,
I feel so puffy now.
I was thinking more like acne. You had some acne issues.
I've had some bouts of that.
But I think now, your skin is looking much, much better.
Yeah.
Anywho, melasma, it's going to look like a mask. That's why it's called the mask of pregnancy. It's going to be a very patchy, just brown cast, and it's very common over the forehead, underneath the eyes, upper lip, sometimes along the cheeks, but it's super classic, if you know.
Yes, and very stubborn too, so it's pretty hard to treat. That's why prevention is really important. So your sunscreen every single day, even if you work from home, just put it on. And then an antioxidant, but we can get into that. Some of our favorites that we have a tab on dewstate.com.
All of our sunscreens.
Yeah, it'll say pregnancy friendly, and you'll be able to kind of just scroll through all the pregnancy friendly options. But
yeah, I think you mentioned this not too long ago. It's 2026, and there's no reason that you can't have a sunscreen that you absolutely love every single day. We have so many because we love so many. So from non-tinted to tinted, foundation looking to lightweight, a mousse kind of texture, to something that's really dewy. So there is something for every single person, I think, at dewstate.com.
I agree.
For a really good sunscreen. My favorites are Pavese Dynamic Age Defense and Revision. Shout out to them because they are treatments and sunscreen at the same time. So if you're looking for something to minimize your routine, those two are treating these problems, but also protecting your skin.
Yes, I love those, and I concur. Okay, next thing to focus on would be your skin barrier. Sometimes in pregnancy, hormonal shifts, you can be a little bit more reactive, and so just focus on hydration.
What do you like for barrier? I can think of one product. Let's say at the same time. Okay. One product that I think of when I think of barrier support. Ready?
What? Oh, I don't know when you're gonna pick. Okay, I have mine.
1, 2, 3.
DJ.
Oh, different.
On balm.
Yeah. What'd you say? DEJ Daily Boosting?
Yeah.
All right.
I think that's what has helped my skin in the past few months.
Yeah, I think it's definitely one of my favorites.
It's so energizing for your skin.
Yeah.
I love it.
I love On Balm because it's this balm to an oil. It's an antioxidant. It's like green juice for your face. It's fantastic.
Yeah, it's great. So anything that has like ceramides, peptides, hyaluronic acid. Another really good one that we have on Dew State is the Renewing HA. That would be fabulous for pregnancy. Even Maestro Revive. I feel like it doesn't get a lot of... It's kind of like on the back burner, but it helps with a lot of hormonal changes. So.
Oh, for sure.
Next one, antioxidants. This is super important.
Your classic vitamin C. Should I say something that's a hot take?
Sure.
I feel like vitamin C's are going to be out soon.
Why?
Because I just think there's going to be better antioxidants out there. I think it's been a gold standard for a long time. I still think that it is.
Well,
but I just think that there's better stuff.
I don't know. I see what you're saying, but at the same time, what I feel like is going to be out is like L-ascorbic acid, and everyone is going to move into THD. And like, for instance, Revisions,
which we have, yes.
Yeah, 30% THD. And all of Revision's products are amazing because they're peptide formulated and they're more of a treatment. But like, it's helping so much with pigment too. Not that vitamin C doesn't help with pigment in and of itself, but like, yeah, I could see that, especially I know what you're thinking of with bioadaptive stress repair. Well,
and just like other antioxidants, like there are other ones besides vitamin C. It is not the only antioxidant out there.
Yeah, I guess.
So I just think that, and because there are so many people, I totally am with you. THD, which is Alto Advanced, which we love, and the vitamin C, C+ correcting complex. Those are definitely different, but yeah, the L-ascorbic acid, hot dog water, she's out.
Yeah, she's been out for a little while. But just quickly to reiterate, like vitamin C will help your sunscreen work a little bit better and more efficiently. It's going to brighten your skin. It's going to help with any hyperpigmentation. And we just talked about being prone to melasma in pregnancy.
And I think the big thing with antioxidants too, when you're pregnant, is think about all the things you can't do. You can't get Botox. You're not getting these lasers. You're not getting chemical peels. And the antioxidants are protecting your skin from all the stressors, all the breakdown that's happening in from the environment. So it's key, especially because you're not able to do all those other things.
So what antioxidant do you think that is going to come more to the forefront?
Well, I think there are so many different ones. Resveratrol, bakuchiol,
because like niacinamide, is that an antioxidant? I feel like that's in everything.
It is in everything, which it actually can be irritating for some people, but the zinc molecule that's in Pavese has a larger antioxidant protection than standard vitamin C alone.
Yeah, so anywho, moving on.
Antioxidants, though. Pick one that you love, use it. Helps your sunscreen to last better.
Yeah.
And will definitely be helpful.
Exfoliation, I think this is one that people get confused about in pregnancy because of that like higher percentage of glycolic or salicylic that are in some products. But like for instance, for years I used the barefaced toning pads, and those have an okay amount of those exfoliation 2%. Acids to use in pregnancy.
Yeah.
I even was looking up, like, can you use alpha-ret peel? Well, I guess not alpha-ret peel pads because those have retinoids in them, but like the polishing pads by Barefaced.
I think they're a little higher glycolic
They are,
percentage.
but I think if you just use them like once a week versus like 2 to 3 nights, I think that is fine. And again, like you can consult with your OB, but it's just the higher percentage of glycolic. We want 10% or less during pregnancy. And then for salicylic, I can't remember. I think it's like less 2 to 3%. Yeah.
But there are great other alternatives than acids. An enzymatic exfoliation is great. The Epicurious enzyme powder, which will last you so long. I feel like I've had it for 2 years and I still have the powder.
And y'all are sleeping on that product.
Oh, for sure.
But really
it's a great exfoliation. You don't have to even mix it with the oil cleanser, which it's fantastic with it. You can mix it with any cleanser. You can mix it with water. Like you can put it on and then put a mask over it, and now you have an enzymatic mask. Like the possibilities are endless with that product. So it doesn't have to be an acid. It can be an enzyme to munch away all the little dead skin cells like a little Pac-Man.
Even keeping up with your facials and doing dermaplaning is a fantastic way to exfoliate.
Oh, yeah.
Just know that your skin during pregnancy it might be a little bit more reactive. So just don't be like dermaplaning your face at home every week and then go get a true dermaplane from, a professional and wonder why your skin barrier is messed up.
Catch me getting 2 facials a month if I ever am pregnant.
Plump me with the most hyaluronic acid you can so that you don't see any of these lines.
Exactly.
Okay, last one. If you have suffered from pregnancy-induced acne, it's probably from your increased estrogen levels, or if you've struggled with acne in the past. So again, ingredients that can help with acne would also help with a little bit of exfoliation. Salicylic, lactic, azelaic is fantastic. It's anti-inflammatory, helps with redness,
it's going to be good for your barrier. It's great all around. It's a little bit of exfoliation. You're covering many different categories with that product.
Yeah, I think a lot of people are sleeping on Ondu.
Yeah, I think it's just because maybe we don't talk about it as much.
Well, I can't talk about every single product.
I know. There are like 60 products in my 45-minute consult. Yeah. But it is a great product, especially if you're, noticing a lot of redness, little acne, and it's a mild acid to help with exfoliation.
So things that I guess we can run through a sample skincare regimen, or maybe we could post this.
Yeah, why don't we write it down, pop it up, post it. We can post it, in the comments and on the feed. We'll give you a sample of an AM and PM routine that makes it pretty simple. 4 to 5 steps that'll keep you glowing during pregnancy.
So you heard us talk about pretty much every single product that we already use, and neither Lauren or myself are pregnant. And so what can't you use? Really, it's Botox filler, and
ablative lasers.
Yes, and a retinoid.
And retinoids. That's the big one when it comes to skincare. And also, caveat, it's probably okay. Don't tell people I said that.
It is probably okay. The oral isotretinoin is not okay. It's pregnancy category X,
That's
right?
Accutane. For everyone listening who doesn't know what isotretinoin is.
Sorry.
Accutane will give your baby an alien head.
Yeah.
Don't do it.
Yeah. What is it actually called? It's
That's for your liver. Acromegaly? No.
No, I thought it was called a specific syndrome when they took Accutane during pregnancy.
Yeah, so don't do that. That is where the vitamin A came from. Isotretinoin and Accutane, high levels of vitamin A. Therefore, they kind of clumped everything into that vitamin A category, which includes a retinoid. So retinoid, retinol, all of those get converted into vitamin A, but a much lower strength. Also, it's topical. You're not ingesting it. You're not eating your retinoid.
Yes.
So there's a lot of things involved there. People just like to put a blanket statement on it to make it safe because nobody wants to be the one that told you to use it and then something happens. They don't test on pregnant women or breastfeeding women. So there's no data to truly say it does not cause any issues, but it probably doesn't.
What can you do in the clinic?
Some microneedling, basic microneedling. We're probably not using like growth factors and stem cells. You can use your own blood, so some PRP is a good alternative. BBL, like a light-based laser, so it's not a laser, so we should take that out, but it's a light. BBL, IPL are lights, so those are safe also.
Yeah, and then I mentioned facials.
Yeah.
Dermaplaning. Those are fantastic. Go treat yourself.
Yeah. So there's a lot that you can do, a lot more than I think you can. So don't throw everything out. But if you need some great pregnancy-friendly products, you can shop the pregnancy-friendly tab on DoState.com.
Yep.
Little plug. Okay. That wraps everything. I hope this helped. Let us know in the comments if you have any questions, if you have a product specifically that you want to know about. We are an open book, and we will see you guys next time. Bye.
Bye.